Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Mental Healthcare Act, and we're looking at 2017 as well as a highlight on the 1987. So the Mental Healthcare Act of 2017, so it was passed to provide for the healthcare. So we're looking at 2017. So it was passed to provide the healthcare and services for persons. So it provides healthcare as well as services. So healthcare and services is provided for persons with a mental illness. Whoever has mental illness, this is provided. And also to protect, promote and fulfill their rights. And it protects, promotes as well as fulfills their rights. And this is during the delivery of the mental health care. So this is during the mental health care delivery. So it has majorly two provisions. Main provisions include the patient autonomy. So there is a patient autonomy. So in patient autonomy, there is a mental ill patient. They have the right to make an advance directive. So they have a right to make an advanced directive and about the treatment and their nominated representative. So they have an advanced directive and it is about the treatment, advanced directive of the treatment as well as a nominated representative. Next is in the mental health professional, caregiver does not wish to follow the advanced directive. So if the mental health professional, so MHP, the mental health professional or the caregiver does not wish to follow. So if they don't follow the advanced directive, so when they don't follow the advanced directive made by the patient, they can send an application to the mental health board to review or cancel or alter the advanced directive. They can send an application. You can send an application, and this application is sent to the MHC, that is a mental health board. Then comes the main provision, that is a decriminalization of suicide. So you do not decriminalize suicide. And the Mental Health Review Commission and Mental Health Authority set up. Next is the Mental Health Review. So there's Mental Health Review Commission as well as the Mental Health Authority, MH Authority. Next we look at the Mental Health Act. So in terms of the Mental Health Act, we are looking at 1987. So here in Mental Health Act 1987, it deals with the care of the mentally ill. So this talks about the care with the mentally ill and makes provision with respect to the property affairs and states the law for the psychiatric hospitals. So with respect to the property as well as the affairs and states of law and states the law for the psychiatric hospitals. So this was along with the 1987. So the important provisions under it for the diagnosis of the mental illness, it includes for the diagnosis of the mental illness, an individual can be kept in a psychiatric hospital for 10 days. So for diagnosing, he can be kept for 10 days. Next is the mental health provision needs for the time. The magistrate can permit extension of 10 more days. So it can be 10 plus 10 days in terms of a permission from the magistrate. Next is the extension can be permitted only twice. So the extension is given only twice. Then we look at thus an individual can be detained in a psychiatric hospital for a maximum period of 30 days only. So another thing is the individual can be detained. So you can detain only for a max 30 days. So max 30 days only in a psychiatric hospital. And if a mentally ill person is detained against these provisions, the responsible authority can be punished with an imprisonment of the 2 years. So in terms it's not followed, the authority can be punished for 2 years. Imprisonment can be performed. To learn and grow daily like this, please do subscribe. Bye.